Hi, everyone. I am Kate with Scottsdale Moms, and joining me today is Dr. Ali Kauffman with Phoenix Children's Pediatrics, and she is in the Scottsdale location. Dr. Kauffman, thank you so much for being with us today.
Yeah, of course.
So glad you're here. Well, Dr. Kauffman is going to talk with me today about something that's very near and dear to my heart. Um, she's going to give us some strategies for parents of children with learning disabilities. And as you guys know, I have one of my kiddos, one of my five, has an IEP and a 504. So learning disabilities is something that I have had to quickly jump into the deep end of the pool. So having someone like Dr. Kauffman with us that just has so much expertise is such a blessing, especially right before school starts. So let's just jump into it.
Sounds good.
All right. So, and as we answer questions, feel free to let us know your background and why this is also near and dear to your heart. So the first question is, what are your thoughts about holding children back a grade level?
Yeah, so kind of what you said, kind of like how you have kiddos who have learning disabilities. I also, it's near and dear to my heart because I also have a learning disability. And when I was a kiddo, I was kind of in that same place where I was really struggling in school. And I remember I was in first grade and like the kid next to me was reading A Tale of Two Cities, and I couldn't even read Cat in the Hat. And my mom was just like lost for words. So I think that situation, and having my mom advocate for me for my entire life. And, now this has really become a passion of mine. And so kind of going into the whole holding back thing. So while the American Academy of Pediatrics obviously says something, I honestly have a personal opinion for it as well. And that's because in that first grade classroom, they really did want to hold me back, and my mom ended up not holding me back. I'm an August birthday, so I'm right at that cutoff too. So I'm the youngest one in my grade, and I personally was not held back, and I got the resources that I needed to succeed, and I'm really thankful for that. So going along with the American Academy of Pediatrics, so they also don't recommend holding children back. So while kiddos, so if they're not meeting the standards for math, for reading, for things like that, you need to get them the help that they need. So by holding them back, you're just teaching them the same thing again in the exact same way. And so that's not really doing anything beneficial for them. So I don't think the answer is holding them back a grade. So and then the other thing is like, it's really detrimental on their emotional and behavior health. And especially with this COVID-19 pandemic that's going on, we as pediatricians have seen so much more anxiety and depression and mood disorders. And I think honestly, that stuff from holding back grade 2, that also is another situation that can increase the risk of that. The Academy of Pediatrics has actually said that holding back a grade level is actually may be considered an adverse childhood event. So what an adverse childhood event is essentially events in a child's life that can lead to increased anxiety, depression, and things like that in the future. So from a personal standpoint, and then also supporting the American Academy of Pediatrics, I strongly encourage people to think about not holding their child back and more getting their child the appropriate resources to keep them in their current grade with their peers for their emotional well-being.
I love what you said about when you hold them back, you're really not doing them any favors. You're just about to repeat the exact same thing that you just did in the same way. And really, it's about finding them the answers about how they learn, what is going on, what setting do they need to be in, what resources do they need. Yeah, I think that's amazing advice. I really struggled with that decision. And my kiddo is very, very, very tall already. He's very tall for his grade level. And so if I was to hold him back, it would be even more obvious that he is not with his grade level. And so now it took us, a good year or two to figure out our groove, but now I feel like, okay, now we've got the resources in place, and yeah, holding him back was not the answer for us either. So,
Yeah. And I
yeah,
mean, kids who could benefit are kids like the American Academy of Pediatrics says, like who have really strong already like self-esteem and emotionally healthy. Um, sure, those people, I mean, theoretically could do well. And so it's interesting because in the studies, so some studies have shown that the standardized test score may go up, but the actual like knowledge of them, their overall learning doesn't go up.
that's
So
interesting.
so yeah, I mean, but again, I respect parents who do decide for their family to hold their child back. Um, that's something that again is a family decision too, but I try to work with families and try to really get to the root of the problem rather than just being like, oh yeah, just hold them back.
Right. I think that's so important to really get to the root and figure out what resources they need. That's great advice. Is there anything specific that parents should be asking the school about?
Yeah. So I think the biggest thing is that parents don't understand that they are in charge. Okay. So parents have so much power. And I think parents need to take that power. And so if you're worried about your child having a learning disability, if you're worried about your child's behavior, if you're worried about anything with your child, you need to tell the school. Okay. And so the, what is it? The something Disabilities Act. Oh my goodness. Individuals with Disabilities Act. I can't even remember what it's called right
Yeah,
now.
idea
Um,
or something like that.
yeah,
Yeah.
so with that, if you present a concern to the school, they have to act on it. So technically, there's a couple ways that you can go about it. So there's, if you voice a concern, they can do a 45-day evaluation of your child, and then they can decide whether they want to go forward with testing or not. That being said, if you already have concerns about your child, I say that you don't necessarily need to go for that 45 days. I would write down, and all you have to do is do a written like consent from yourself. It doesn't have to be from a pediatrician, it doesn't have to be from anyone. It just yourself, and you write, I would like my child to be tested. So once you submit that in writing documentation, the school has 60 days to perform an evaluation on your child. That being said, the schools can do an extension. They can make a 30-day extension, they can do a 60-day extension, but they have to have parental approval before they do that extension. So I think that it's really important for parents to know their rights and know that that child deserves an evaluation within 60 days. And so knowing that you have the power to do that, I think is something that I would definitely reinforce to parents. And so, and then the other thing is when asking for testing, like being specific and being like, hey, this is what I'm concerned about. I'm concerned about learning. I'm concerned about reading. I'm concerned about math. And so that they don't just do like one of the little tests, like you're like, I want a full workup for my child to see what's going on, because they have that right. And I think that that's one of the most important things for parents to know.
It's such great advice because before I started this journey, I had no idea what, I never had to look into it. And I really didn't even know where to start. I had no idea of what verbiage to use, even who to ask if I was supposed to ask their teacher. But you're so right. Once you just start Googling, start talking to your pediatrician, start talking to other parents that also have kiddos with 504s and IEPs. There's really a really amazing community out there where you can support each other and get the answers and learn how to advocate for this.
Mhm.
Yeah, I think that's amazing advice.
Yeah, and like for the IEP, like making sure that you're asking for it and that you're asking for that IEP, making sure that you're asking for that 504 plan. And this is all in your parental rights. Um, and sometimes, like I said, so I've had so many families that sit in the room with all of the people in the meeting, the administrators, their lawyers, and sometimes it's really hard to be heard. And so I encourage families to really stand up for themselves. One organization, Raising Special Kids, is a great organization. And they also can hook you up with people within their organization who have been through similar things. And I have a few patients who do have what's called an educational advocate. And something that's really hard with an educational advocate is, for the most part, these are people who have been in administrative, who come out of administrative work within the schools, and they do cost money. However, I have heard that there are programs through Raising Special Kids that don't necessarily cost money. So, for example, I have a patient today who mom has gone through so much with her two kids, and she has this educational advocate who goes with her to all the meetings, and she's like, she is a force, this woman, and she'll correct the administrators on things, and she just got so many therapies for her child. But again, it's really hard because some things do cost money, and is that necessarily fair? No, but you got to do what you got to do for your child, and so get the help that you need. And whether that's with Raising Special Kids, who, like I said, that is a free organization, or whether you go out and find that educational advocate, or whether you're just going to do it yourself and you're going to fight for that child, you have to do it, because you're the most important person in this process as a parent.
I agree. That is one thing that I agree. I would encourage everyone walking this journey to get a community, find a Facebook group, find a mom's group, find somebody, because you're right. Those meetings, when you walk in, so for those of us in our audience, that an IEP is an individualized education program. Plan.
Individualized, yeah.
And
Yep.
And so basically you're sitting down with all of the teachers, administrators, everyone involved in your kiddo's education, everyone, and the principal, and then you. And so it can be intimidating because there's this whole group of people and you. And so it can be intimidating if you're in the room with people who may not agree with what you're hoping the strategy will be, or what you have been told maybe by a therapist that the strategy should be. And so, yeah, if you're uncomfortable at all holding your ground, find some support. Either have them help you write, stuff on a legal pad when you walk into that meeting, or bring somebody with you. My mother is a retired teacher, 21 years. And so she always, before the meeting, she sits down with me with a legal pad and we go over all the questions. And it makes it really easy for me, because then it kind of takes the emotion out of it. And I'm just looking at questions on a paper that I need to get answered. And it's like, no matter the opinions, these are the questions I've got to get answered and got to get going. So yeah. Well, our last question, which I think you have already addressed, what do you see that is a consistent recipe for success?
So I really think that the parents being the most involved are the main thing that's going to help your child. So a parent that's going to fight for their child to get the help that they need. It could be a mom, it could be a dad, it could be a grandma, it could be an aunt, it could be an uncle, foster parent, anything like that. But you need these children need you. And so someone has to stand up for them. And so I know when I was a little girl and my mom helped me, like my mom, teachers did not like my mother. So like, don't be worried if people don't like you. And so for me personally, my older sister is that perfect child, who's straight A student, all the teachers loved her. And then here I come and I just, tear up the place. But you know what? It had a name. My learning disability was dyslexia. And I've worked so hard throughout my entire life to get better, to improve. And I still have struggles with it today, but without my mom supporting me, and I mean, my dad was there too, but without my mom being my biggest advocate, I would never be where I am today. And I just want to kind of also say that I want these parents to have hope. I want them to realize that just because your child has a learning disability doesn't mean that they're not going to make it super far in life. I was told by so many people when I was little, like, that I wouldn't. And I'm here to tell you I did. I'm a pediatrician. I love what I do. I care about what I do. I love my job. And I'm really smart. And so for all those parents out there who need to be told, like, your child is smart. Some of the smartest people in the world have learning disabilities. So be that rock for your child, and they'll get through it. And if people need help, ask your pediatrician for help. Come to us. Like, I'm always happy to help. And so I'm a fighter, and I'm not afraid for someone not to like me because I'm helping their child.
I am so thankful for, first of all, your willingness just to talk to us about your learning disability, talk to us about why it is, a personal connection for you. I'm so thankful for your mom that was willing to not be liked so that people would listen. And I'm just incredibly grateful for your vulnerability and your willingness to say it, because as the mom of someone with learning disabilities, it is exhausting, and it's
Mhm.
so encouraging when someone comes forward and says, "Hey, I did it. It was hard work, but I made it to the other side. And
Yep.
here's what it could look like." Like,
Mhm.
it is so wonderful to have a vision of, it's not always going to look like this. It's not always going to look like this many hours of tutoring and highlighting papers orange, and it's not going to always look like this. There is another side to this. There's a path forward. So I'm just incredibly grateful for you and your
Yeah.
story and your willingness to share it. Thank you so much.
Of course. Yeah, definitely.
That's great. Well, so again, this is Dr. Allie Kauffman with Phoenix Children's Pediatrics, and she's in the Scottsdale location.
Yeah.
And you can find information about Phoenix Children's Pediatrics at Phoenix Children's with an S, pediatrics.org. So Dr. Kauffman, thank you so much for your time today, and we really appreciate you being on our community.
Yeah, and thank you so much for inviting me on here, and then also keep up the great work with all of your kids. They're so lucky to have you as their mom.
Thank you. Thank you.